Hello, I'm Dr. Steven Sparagona, and I work very closely with pediatric patients who have TSC. Now, I'd like to share my experience with you. Patients and caretakers can feel reassured if they can look to someone who takes all aspects of the disease into account and who is aware of current issues and potential problems. It's also important to involve different specialties which can positively impact a patient's life. For example, psychiatric management may be important regarding some of the neurobehavioral aspects of TSC. I believe that a lot of people can benefit through involvement with the TSC community, which includes other families affected by TSC. I feel that having a link to others affected by the disease is very important to patients. In fact, it's been very powerful for my families. Everybody with TSC is different, and their experience depends on the manifestations they're encountering. Not all patients will have all symptoms. A patient who has minimal brain involvement still may encounter depression and anxiety. So I think it's important to maintain good mental health and know how to seek help when necessary. Patients with more severe neurological disease will need their families to act on their behalf. For the behavior and cognitive issues, the specialist, a psychologist, psychiatrist, or therapist is key. Because there's a 50% chance that a person with TSC can pass it on to their children, information about genetics and reproductive capability is important for patients to understand. So seeking genetic counseling may be of great value. When a patient comes to my office, I try to discuss each of the manifestations that the individual presents with. If they don't have a problem at that point, I discuss the risk of complications that may develop over time. I discuss overall prognosis based on the severity of the disease, and I also address the genetic nature of the disease and typically recommend genetic testing. I also provide them with information they can take with them. Finally, I inform them about support systems that can potentially help. When visiting a neurologist, there are specific questions patients can prepare to ask. For example, what are the potential complications I may encounter? What are the best ways to evaluate those possible complications? They can also ask about the genetic aspects of TSC and how that might relate to themselves, their family members, and what it may mean for their children. Shifting gears, I also think that schools can benefit from information, as I don't believe many are familiar with this disease. Overall, TSC is now better understood than ever before. The amount of information that has come forward in the past 20 years is phenomenal. So it's helped us understand the genetic nature and pathophysiology of the disease. I'm optimistic that moving forward, people in the medical community will learn even more about this complex disease, so we can help TSC patients in the best way possible.